Come, let's get straight into the questions. This one came in bright and early this morning. Question for Anneliese, please. Is there anything I can do to ensure the uptake of vitamin B12? Ended up having to get injections as my B12 was so low and I was extremely tired. What's the best oral supplement to take? I'm wrecked from it. Thank you.
Yeah, and it is a big thing actually, Patricia. People who are unable to absorb B12. So we need to have something in our stomachs called intrinsic factor that binds on to vitamin B12, and that's how it gets absorbed in the body. And in order to have intrinsic factor, you need to have very, very good, strong stomach acid. So people who are on the acid blockers, the proton pump inhibitors for reflux, they would certainly find it very hard to absorb vitamin B12. And actually also I do think genetically a lot of people are very poor at absorbing B12. So sometimes actually taking a supplement is no good because it's still not absorbed properly. So the best ones are the ones that are absorbed what they call sublingually, which means across the mouth. And the one that we get the best results here from is a Solgar one, and it's vitamin B12 nuggets. If you ask for those, they're tiny little kind of pinky flavoured, cherry flavoured nuggets that you just chew in the mouth and you leave them dissolve or chew in the mouth and the absorption takes place there. So it bypasses any difficulties that you have. Other people who'd be at risk of deficiency of B12 as well would be people who would be vegan, because we mostly get it from animal sources. So if you are vegan or vegetarian and you want to increase B12 in your diet, you can add the nutritional yeast, and that works very well for some people.
Okay, good luck with that. Could Anneliese suggest what is the best CoQ10 to take? I'm on a cholesterol tablet.
So the cholesterol tablet, Patricia, blocks a pathway in the liver that makes cholesterol from saturated fats. But that pathway is also responsible for making a vitamin called coenzyme Q10. And coenzyme Q10 is essential for our energy pathways. So if you become deficient because you're on the statin and that pathway is blocked, you might get things like muscle pain, particularly across the back of the shoulders or in the legs, weakness of the legs, fatigue after exertion, so maybe feeling abnormally tired after climbing a stairs. Some people might notice their short-term memory is affected. And in those cases, it's very good to take a vitamin coenzyme Q10 supplement. So there's different types. There's the active one, which is the ubiquinol. And that is probably one of the better ones to take, but it's far more expensive. So I think if you've got some of the side effects from taking a statin, take the ubiquinol, which is more expensive but is the active form, and you probably need at least 100 milligrams. But if you don't have any side effects and you just want to be on the safe side, you could take the ubiquinone, which is the inactive form. We can activate it within our bodies, and you can take maybe 30 milligrams, which would be cheaper. So the brands that we have here in the shop, I know that One Nutrition do a nice one. They are an Irish company. They do it either as capsules. You can also get an oral spray from them. We have got the Pharmanord ones. We get good feedback on those as well. The Nature's Plus Beyond Q10 is probably one of the best ones. And of course, Viridian do a range, and they're always good quality too.
Okay, a couple of people seem to be suffering from tinnitus. Somebody says, "Hi, Anneliese, can you recommend anything for tinnitus?" And somebody else says, "Is there eardrops you can get for tinnitus?"
So, you know what, Patricia, if I could invent something for tinnitus, I swear I'd be a rich woman, because it's so common. So there's different types of tinnitus, I think, not being an expert, but this is from my experience of people. There is tinnitus that happens when there is hearing damage, maybe as a result of listening to loud sounds, or maybe long-term damage from an ear infection or something like that. That tinnitus is very, very hard. There's really nothing that will work for that in terms of taking. The other type of tinnitus, I think, comes sometimes after a viral infection or an ear infection, where the canals of the inner ear become inflamed. So the inflammation can be dealt with by taking natural anti-inflammatories. And we've had some success here by giving people a natural anti-inflammatory supplement, again by a company called One Nutrition. It's called P4 Immune. And it is a very powerful natural anti-inflammatory supplement. And we pair that as well with an inner ear kind of probiotic, which is Lactobacillus salivarius. And that can sometimes, for some people, give them a benefit. So I'd suggest that people try it for a couple of months, and see if they get any lessening of the noise. But if not, it's probably not going to work. And rosmarinic acid sometimes can work as well, that you get from rosemary. So if you've rosemary in the garden, you could drink it as a tea, or you could buy a good quality rosemary essential oil supplement and you could take that as a tea as well.
Okay, I don't know if you can offer advice here or not, but Mary's daughter, a 19-year-old, has recently developed epilepsy. They've discovered that it's bright lights are the trigger. She's wondering, is there anything you can suggest from a nutritional point of view to help with epilepsy?
Yeah, absolutely, actually, Patricia, and this really probably needs to be done in conjunction with a medical professional, but there is quite a lot of research on cannabis oil and its ability to reduce the amount and severity of epileptic attacks. So you can buy cannabis oil that has no THC in there, and that works very, very well for some people, and I have lots of customers that are epilepsy-free. Also, following a ketogenic diet can be very helpful for some people as well. So a ketogenic diet means cutting out all carbohydrates, and very extremely, Patricia, so that your body goes into what's called a process of ketosis, where it's burning fat as a fuel. And that can drastically reduce the amount of epileptic fits as well. So between the two of those, you could probably have a very, very good success rate. And for some people then, they still do get epileptic fits even on the cannabis oil, and they may need the medicinal cannabis, and in this case your doctor can definitely prescribe that. It's legal in Ireland for that use.
Okay, hi, Anneliese. This is from Pat. I've chilblains on my fingers. Anything to prevent them in the future, and for the current chilblains I have, what would you recommend?
Yeah,
do you hear about a lot of people getting chilblains?
Yes, definitely. And actually, it's a lot of people who work outdoors as well, Patricia, that are going from, like a lot of people farming and milking. It would be very common because the milking sheds would be very cold. And they might be going from hot to cold to hot to cold. So it's quite a common one. Normally I recommend that people take something like horseradish and garlic complex at the beginning of the cold season, and that's very good to improve circulation. And then we often recommend the Dr. Dealish Clare anti-itch cream, or even the healing cream that she does is very good as well, just to put on it to get rid of the itch when they are so desperately itchy. But it's about supporting your circulation. So if circulation is poor, you'll definitely be more prone to getting those chilblains. And for some people then as well, if they're working outdoors, we would recommend that they would actually use the cream on their hands as a preventative, just to kind of create a barrier, and to maybe wear gloves on top of that then.
Okay, hi Anneliese. Can you take red yeast and Q10 indefinitely? Are there any side effects to taking them long term?
Yes, there definitely is, Patricia. So the red rice yeast most people take for cholesterol, to bring their cholesterol down. It actually does exactly the same thing as the drug does. In fact, I think the drug originally was discovered by looking at the monocolin K from red rice yeast, and then it's now been made synthetically. So the same things would apply to still taking the drug, which is you need to have your liver checked fairly regularly. This goes for people on a statin as well, Patricia, to make sure that it's not affecting your liver function. Now, it's rare that it does affect your liver function, but for some people it may. So when you go for your annual blood test, as well as getting them to check your cholesterol to make sure it's still being controlled by red rice yeast, get them to do your liver enzyme check at the same time.
Hi, Anneliese. I've been diagnosed with fatty liver. What can I take to reduce it? That's from Bernie.
So fatty liver, Patricia, we're seeing more and more of it now, and I think it's a large part to do with our diet. So really, since the 60s, our diets have been become very high in processed carbohydrates. So it's called non-alcoholic fatty liver, Patricia, and it means that your liver begins to store large amounts of fat, generally as a result of high triglycerides, which are made from excess carbohydrates in the diet. So there'd be a link between non-alcoholic fatty liver and type 2 diabetes as well, and certainly with weight. So if you lose weight, you'll probably lose weight from losing fat in the liver. But in terms of diet to follow, a low-carbohydrate diet is the best one to follow. Again, you could go down the very extreme route of the ketogenic diet that I spoke about earlier for epilepsy, but there's less extreme versions that will be very low in carbohydrate, and that will help prevent it from getting any worse for sure. And then in terms of supplements, I always recommend berberine, which is a fantastic supplement. It comes from the berberis plant that a lot of us have in our garden. And it actually in some trials has shown to be as effective as using the metformin drug. which most people take for type 2 diabetes. And this basically just helps to manage the whole insulin, carbohydrate, fat storage issue that goes wrong with non-alcoholic fatty liver. And then there's also a supplement called alpha-lipoic acid, and this is very protective of cells when insulin and sugars are elevated in the blood. So I would recommend that as well. And then the final thing is maybe something like milk thistle or N-acetylcysteine. And Viridian do a lovely N-acetylcysteine plus supplement, Patricia, that has got cinnamon and chromium in there. And that helps with the insulin carbohydrate balance, which prevents fat from being laid down in the liver.
Okay, one final one. Hi, Anneliese. Anything for a cure and an ulcer in the small bowel? It was caused by gastroenteritis. What diet is the best? I've lost 3 stone in weight. I can barely eat it. It's so painful all the time.
Yeah, very, very painful, Patricia. An ulcer anywhere is very painful, but it's very slow healing there as well. So after a gastro, so there's a huge amount of inflammation, Patricia, and what you really need is you need a gut healing supplement. So there's a couple of them. If you can go to your local health store, or if you have a nutritionist that would be able to get this for you, there's a very good practitioner supplement by a company called Nutri Advanced. And it's a gut healing one called Nutrimonium, Nutrimonium. And that is fantastic. It's full of things for inflammation in the gut, but also for gut healing. If you can't get your hands on that one, because it's a practitioner on, I think we have it here, there's one called GI Nutra Wellness by a company called Nature's Plus, and that should be available in most health stores. So that would be another gut healing one. And then finally, if you can't get any of those, something that has a combination of things in there like marshmallow, slippery elm, aloe vera, and L-glutamine are all very good for an inflamed gut.
It's to try and heal it. Okay, listen, as always, thank you for that, Anneliese, and we'll talk again next week.
Thanks, Patricia.
Bye-bye. And Anneliese will put up, as heard on the radio, on her website, healthhubstore.com, and John Paul will put it up as a podcast.